Hello and welcome. Thank you for being here. My name is Jeremiah Aha, and I'll be hosting us today. I'm Assistant Director here with Wellness Together School Mental Health. And just first off, I want to say thank you for making this a part of your day. We're so glad that you're here. We're very grateful for the partnership with California Department of Education, and glad that you are here with us today for supporting you, supporting students, a three-part webinar series. And just a few housekeeping items here. If you do have questions for our panelists, because they will be answering live question and response here at the end of our webinar, feel free to click on the Q&A tab at the bottom. And we have a team, Wellness Together team members that are collecting those questions, and that will be taking a look at those to ask to our panelists at the end. So if you have a question, both technical as well as for our panelists today, feel free to leave those in the Q&A portion of your Zoom window there at the bottom. If closed captioning is something that would be helpful for you, please click the closed captioning tab. There should be at the bottom of your Zoom window. You can also show subtitles as well as turn subtitles off just by clicking that CC closed caption tab there at the bottom. I think that is it at this point. I think our panelists are here. Again, thank you for your time. I'll now turn it over to our founder and executive director. Actually, real quick, just to share with you, we have pieces that also for support, and that is all of the resources for today are going to be dropped into a Google Drive folder for you. And you can go and find that on any device at bit.ly/supporting you, supporting students. So it's a bit.ly link, bit.ly/supporting you, supporting students. And in there, you'll find 3 folders for today's presentation, next Thursday's, and also on April 23rd. And every presenter will have their folder in there with all the resources in there. And by the end of the webinar, that will include their slides. So feel free to take a look at that again, bit.ly, supporting you, supporting students. And again, we have a place for you to submit questions there at the bottom. And now I will turn it over to our founder and executive director for Wellness Together School Mental Health, Marlon Morgan. Marlon?
Thanks, Jeremiah. Thank you for joining us here today. We hope you and your loved ones are safe and healthy during this time. We're so grateful for all of today's presenters and the partnerships with the California Department of Education and the Office of the Surgeon General. It's been great working together to make these webinars happen. Our purpose here today is to connect you, equip you, and encourage you. This is a time to connect with helpful resources, hear about legislative updates regarding student mental health, and learn strategies that will be helpful for all of us as we support the students and families we serve. This is also a time to be mindful of the connections that we make with each other as a measure of self-care and encouragement. Now, perhaps more than ever, we're realizing the need for meaningful connections to be the best versions of ourselves. As we know, for many of our students, school is their safe place. And during this time, we want to make sure that we make every effort to bring what we can from that safe, structured environment back into our students' lives. We're approaching the 1-month mark for school closures, and already we're seeing the negative impact that necessary social isolation is having on our students' mental health. It's important, again, now more than ever before, to reach out to students and let them know we're still here and we still care about them. And many of us as professionals are grieving and experiencing loss at the same time that we're reaching out to help others. And as helpers, many of us feel that we need to have all the answers. It's important to acknowledge that none of us have all the answers, but instead we have each other and the ability to share our time, collective knowledge, and experiences with one another. Please remember to take care of yourself during this time. And know that even in the midst of great loss, we can find hope in the meaningful ways we respond to this crisis. And at this time, it is a privilege to introduce Khieem Jackson, the California Deputy Superintendent of Equity and Access. He's responsible for leading approximately 1,200 staff who perform critical work in programs that support our most vulnerable students in the state. These programs include the State Special Schools Division, which encompasses the schools for the deaf and the blind, and the diagnostic centers, the Educator Excellence and Equity Division, which includes the Mental Health Services Program. Kai also brings to the table many skills he's learned as a U.S. Marine. His military career and the lessons that he's learned are pivotal in helping to lead the California Department of Education. Deputy Superintendent Jackson, thanks so much for being here with us today.
Good afternoon, everyone, and thank you, Marlon, for that kind introduction. It's really an honor to be here with thousands of outstanding professionals who genuinely care about our students and their mental health. The CDE is pleased to partner with Wellness Together and all the partner organizations to bring you this webinar series to continue our united efforts to support student mental wellness during these unprecedented school closures and crisis. I want to acknowledge Wellness Together for all their dedication and hard work in meeting the mental health needs of our students. Their partnership has been integral in bringing high caliber conferences, workshops, and webinars and highly needed services to the field. Thank you, Marlon. Thank you, Jeremiah Aha, for your leadership and for your partnership. So first, let me start by saying that the health and safety of our staff and students is top priority for our State Superintendent of Public Instruction, Tony Thurman, for myself, and for all of our branch staff and the entire Department of Education. Superintendent Thurman is deeply committed to the physical and mental well-being of our students, and education has been the core of his career. As a social worker, parent, and public servant, he acknowledges the importance of taking care of our students so that we can all have a bright future. The state superintendent is working diligently with the CDE staff and all of our external partners to ensure that you are receiving timely and relevant information that should help make your jobs easier. We do fully recognize the stress and worry this situation has brought on to you, to your students, and to their families. And we are working tirelessly to provide guidance to the field. I think I can safely say that most of us on this webinar are aware of the research that indicates that as much as 20% of students in our kindergarten through 12th grade grades suffer from mental health issues that may affect their functioning in school, at home, and within their community. And although I don't have figures with me at the time, I can assume that this pandemic has increased the need for mental health services, since we know that many students are experiencing new and ongoing trauma and are doing so without the daily support of their teachers, their peers, or other staff. Before school closures, we were already keenly aware that we needed to lean in more to better serve the multitudes of students suffering from mental health challenges. Now, more than ever, as Marlon said, it is imperative that we reach out to our students first and foremost to ensure their safety, and secondly, to determine what their needs are so that we can connect with them and connect them to appropriate resources. We know it is sometimes difficult to identify these students who may be experiencing emotional distress when we have them in front of us. Now that we're doing a lot more remotely, the challenge is even greater. I can't stress enough the need to reach out to them, each and every one of them, because many may be suffering in silence, and some may even be quietly contemplating suicide. Tragically, 6 young lives have ended too soon. The Department of Education has been notified of at least 6 youth suicides throughout the state in this short period of school closures. We need to take action because this cannot continue. There is much work to be done, and I know we're all ready to do our part. As a matter of fact, I know we're all ready to do a little bit more to ensure that we have a real safety net for our students and can protect our students. Our jobs will be a little bit heavier than usual, but we must continue to strive to maintain a safe and welcoming environment that we've created, but we continue that in this e-learning and remote environment. And I know each one of you are up to the challenge. I'm honored to share this forum today with the California Surgeon General, and thank you for being here, ma'am. You are a lighthouse and a beacon for California. And our other presenters today will share best practices and moving forward remotely. And I'm excited to hear from our speakers. You will hear valuable information that you will be able to put to practice immediately. So in closing, I'd like to just remind each of us, like what Marlon said, to have grace with ourselves, be gentle with ourselves, and support others as we navigate this pandemic and these unprecedented times. Thank you, and on behalf of our State Superintendent and the Department of Education, we are here to support you all. Please check out our website that has valuable resources that you can use in your communities and your schools and share with everyone. Thank you.
Thank you, Deputy Superintendent Jackson. We are so grateful to have you and all of our public officials who continue to unify and lead us through these challenging times. California has recently been recognized for its diligent work in responding to the crisis, and we are honored to introduce our state's first Surgeon General, Dr. Nadine Burke Harris, to share with us how California continues to respond to the threats to our physical and mental health. Surgeon General Burke Harris is an award-winning physician, researcher, and advocate dedicated to changing the way our society responds to one of the most serious, expensive, and widespread public health crises of our time, childhood trauma. Dr. Burke Harris was appointed as California's first ever Surgeon General by Governor Gavin Newsom in January of 2019. Her career has been dedicated to serving vulnerable communities and combating the root causes of health disparities. She is the founder of the Center for Youth Wellness, an organization leading the effort to advance pediatric medicine, raise public awareness, and transform the way our society responds to children exposed to adverse childhood experiences, or ACEs, and toxic stress. Surgeon General Burke Harris, I speak on behalf of thousands of attendees here today. We are privileged to have you with us. Thank you for your time and your leadership.
Thank you so much for that warm introduction. And can you all hear me okay? I want to thank everyone on the webinar for joining us today, and thanks to our organizers, Wellness Together and the California Department of Education. I am so pleased that you all are starting this webinar series with focusing on care for the caregivers, because there has never been a more important time for self-care than right now. This COVID-19 pandemic is presenting all of us with unprecedented challenges. And what we're seeing is that in addition to just the stress of the pandemic, right? We're also seeing the challenges in terms of the necessary measures that we have to take to respond to the pandemic. So there's the economic distress from folks who are losing employment and losing wages. There's compounded on top of that, the challenges for so many of our wide-scale school closures, which means that kids are at home with parents who are often stressed out and at the end of their rope. And on top of that, the physical distancing limits the thing that we know is one of the most effective antidotes to stress and adversity, which is that human connection, those safe and stable relationships. And so we recognize that now is an incredibly risky time for kids who are at home. Whilst for some kids, being at home is a safe place, and that's what we would wish for everyone, we recognize that, unfortunately, that isn't the case. And there are many kids across our state who are experiencing significant adversity at home. We're already seeing rates of intimate partner violence rising. And right now, what we're seeing, unfortunately, we're getting reports that rates of child maltreatment are actually, rates of the reports of child maltreatment are actually declining. And we believe that that is because kids simply aren't in contact with the safe places, the safe adults who would be making those reports, which are our educators. So it's never been a more important time for us to recognize that students may be vulnerable and figure out how we can reach out. And several things that we've been doing on the part of the Newsom administration is, number one, we've developed the Surgeon General's playbook for individuals for managing stress during COVID-19. And we've also developed a separate playbook for kids and caregivers for managing stress during this time. And those resources are available at covid19.ca.gov. But in addition, we've also created an emotional and well-being page on the covid19.ca.gov website that has a list of resources and hotlines for anyone who's looking for additional resources. So right now, we need you all more than ever. And that's why it's so important for you all to be practicing the self-care, right? That's going to keep you doing this important work for the long haul, because we recognize that this is a marathon, not a sprint. When we look at the mental health and the physical and mental health, right? Because we know that they're intimately connected. Those consequences from the COVID-19 pandemic are going to be continuing long after we have reopened schools and reopened our society. And so this is really long work. We need you to be practicing that self-care so that you can be in there and available to be doing that long work. And one of the things that I want to recognize and acknowledge is that even before this COVID-19 pandemic came about, my office was charged by Governor Newsom with leading a first in the nation initiative to address adverse childhood experiences as a root cause for some of the most serious challenges facing our state today. And we've been very excited to focus on screening, bringing in our primary care workforce, training doctors across the state on how to screen for adverse childhood experiences and how to respond with trauma-informed care. And we recognize that you all, as school mental health providers, are the close partners in this effort, because this has to be a public health initiative, right? This is not just something that we can address in a doctor's office, but rather we recognize that across society, right, all of us have to recognize how to recognize and respond to adverse childhood experiences as a root cause for some of the most serious risks that we're seeing. You all represent a vital link for the young people that you serve. And so right now, when we're looking at the increased stress that we're all feeling, right? Those rising levels of stress hormones, the increases in adrenaline and cortisol and all of the things that we talk about in terms of the biological stress response. We want to recognize that that's not just going on for the youth that you serve, but that this may be something that's impacting you as well. So if you find yourself reaching for that extra bag of potato chips, if you find yourself feeling a little bit more exhausted or a little bit more overwhelmed, we recognize that the changes with the pandemic, right, in addition to the changes to our normal routines and the stresses that we feel as those who are on the front lines, are higher than ever. So as you go into this webinar series, And as you continue to make the switch to not only the distance learning that's happening in schools, but the remote connections that you all have to make now with the young people that you care for, I just want to encourage you as much as possible to be kind to yourselves, to practice that well-being, that mindfulness, all of those resources that we know help to support us in times of stress. And I want to thank you sincerely on behalf of the governor and on behalf of the state of California for the important work that you are doing to support our students and just convey to you how much we see that it's vitally needed now more than ever. Thank you so much.
Surgeon General Burke Harris, thank you very much for your time, not only for validating where we're at as educators and support staff and those that are serving California students and families, for letting us know that it's okay to go through maybe some of the confusion or the stress we've been experiencing, as well as thank you for encouraging us in this time. And you're right, almost 4,400 people that are on here, we do need you. So thank you for the work that you are doing. And we are glad to partner with Office of the Surgeon General, as well as California Department of Education to offer you these trainings for this month. To highlight a couple of things before we go in, before I introduce our first presenter, that is that this webinar will be recorded and available within the next few days for you or for those of your colleagues maybe weren't able to join us. So it will be available, an email will be sent out to you to have this. And again, to highlight the resource link that will be available for you. If that was a little too quick for you last time, that is bit.ly/ then just the name of the webinar, Supporting You, Supporting Students. So take a look at the resources that are going to be in there, and all the presentations and slides and other supplemental materials will be in those folders for you. Additionally, a few things. Also, thank you for your time, Deputy Superintendent Jackson, for being here, and this partnership has been great in order to work together with you all to serve California's educators, California students, and families. So thank you for that. Also invite all attendees to leave questions there in the Q&A portion. We see quite a few piling up. If there's a technical question, our team will get back to you as soon as possible. We're digging through, as you can see, several thousand. And thank you to the almost 7,000 people that signed up. And we're sorry we couldn't be with you in person last month, as I'm sure there are many here that were registered for the conference in Anaheim. But obviously, in light of the challenging times and the things that are around us right now in the world, we couldn't meet you in person. So we thought this would be a helpful thing. So now I'm going to introduce our first presenter. Her name is Mayra Alvarez, and she is the president of the Children's Partnership. And this is a nonprofit children's advocacy organization committed to giving every child, no matter their background, the resources and opportunities they need for a bright future. Under Mayra's leadership, the Children's Partnership is building strong community partnerships, conducting forward-looking research, and advancing informed policy that betters the health and well-being of underserved children throughout California. She combines her decade of experience in healthcare policy and community outreach with her personal conviction that every child and family should have the opportunity and the resources to pursue their dreams. Mayra began her professional career as a David A. Winston Health Policy Fellow in the office of then Senator Barack Obama. She completed her graduate education at the School of Public Health at the University of North Carolina at Chapel Hill, and her undergraduate education at the University of California at Berkeley. Currently, Mayra serves as the Board of Social Interest Solutions and is actively involved with the Summer Enrichment Program at the University of Michigan. She's originally from El Cajon, down south, and currently lives in Los Angeles with her husband. Mayra, thank you very much for being here.
Thank you, Jeremiah, for that warm introduction. I'm honored to be a part of this esteemed group of panelists, and thank you for the leadership in holding this important series of presentations. I'm going to share my screen. and hopefully it works. Great. So thank you again for allowing me to be with you today. The planning for this presentation was quite the whirlwind, as folks on the line can imagine, given that there are things changing every day, especially here in California, given the leadership of our governor. But I'm honored to be with you all, and I thank you for the work that you all do day in and day out, and appreciate your leadership in our communities and with our families. I have the responsibility of just giving you all a policy update related to COVID-19, with hopes that gives you some information regarding some of the federal packages that have been moving, but also some of our state actions that impact children and youth across California, and hopefully present to you some information that could be useful in the work moving forward. So Jeremiah did a short introduction of the Children's Partnership. For those that don't know us, I hope you do get to know us. We are your partners in our work to ensure every young person in California can succeed. We really do try to strive to advance policy that improves the lives of children through our partnerships on the ground, partnerships with many of you, but also through quality research and policy priorities that reflect the needs of the communities we serve. We believe that on a national level, you can look at any of our biggest goals as a country, whether that's helping our students succeed in school, or creating jobs, or building stronger communities. Improving health contributes to every single one of those goals. And on an individual level, health is fundamental to opportunity. The healthier we are, the more freedom we have to pursue our dreams, contribute to our families, our workplaces, and our communities. And we know that when we have a healthier country, it's many more of us that can reach our full potential. So we also recognize that health is far more than what we learn at the doctor's office, and that if we really want our students to succeed in school, if we want them to have a connection to so many other facets of life, a real path toward equity, that path must include a path toward health. So with that context, I just want to get us started. In my time with you today, I'm going to give a short federal policy update, really talking specifically about the emergency packages that have been enacted in response to COVID-19. I will speak a little bit about state policy updates, particularly the actions from Governor Newsom. I will talk a bit about key telehealth policy changes, just recognizing the shift to a virtual environment in which we're living in today, and how we are utilizing that environment to reach families and young people specifically about their health and well-being. I'll talk at a high level about some recommendations for supporting all children in this environment and moving forward. And then finally, a few strategies for sustaining school-based telehealth, particularly as we move forward in this political climate. So first, the federal policy update. So as many of you know, the federal government has passed a few emergency spending packages in response to the coronavirus, and currently an additional package is being considered. The packages contain specific many provisions that are probably far too many to cover in today's presentation, but I did want to provide a high level overview. If we try to remember back to early March, Congress passed a Supplemental Appropriations Act that really limited its spending on the public health system and back development and needs, and then quickly pivoted to talking more about how we have a responsibility to support our community members in this time. And the Families First Coronavirus Response Act was passed a couple of weeks later in the middle of March. That package, the Families First package, included support for testing, but it also included funds for unemployment insurance administration, not increased benefits, but unemployment insurance administration, some paid leave for employees at organizations that have under 500 employees, also some exceptions for businesses under 50. It did include some nutritional assistance, particularly a nationwide waiver for providing meals to students under school lunch, but also the expiration of the pandemic EBT card to support children, in particular those that may not have a parent that's able to pick up meals at different sites, such as the emergency food assistance that we know many families are in need, given that many students utilize the school lunch program or school breakfast programs and are missing that by not being at school. So providing those resources was particularly important. There was also some SNAP investments made in the Families First Act, but not as much as many advocates across the country wanted to see, given the importance of the food stamp program in helping families meet their basic needs. In addition, the package did include additional resources for Medicaid, or Medi-Cal here in California, which is the health coverage program for about a third of Californians, many of which are low income or are unemployed and rely on Medi-Cal for health coverage and health services. In particular, it included additional resources in the form of an increase of 6.2% in the federal match. So that's tens of billions of dollars for states that maintain their enrollment in Medi-Cal. So that's an important lifeline for states that are looking for support in this time. And then most recently, just a couple of weeks ago, the CARES Act was enacted, and that's about a $2 trillion package that Congress enacted that went further in its support for families, really offering direct support to states, communities, and families. The one that has been making a lot of it, or has been receiving a lot of attention, has been the one-time payment for stimulus checks. This was for all individuals who filed income taxes for 2019 or 2018, or Social Security beneficiaries. It's important to note that it is reliant on someone having a Social Security number, not an individual tax identification number. So for California, that does leave out a portion of our residents here in California. The stimulus check is about $1,200 per adult and about $500 per child. It does phase out at $75,000 or about $150,000 per couple. It also includes about $500 billion in loans to struggling industries as an economic stimulus, as well as a number of additional resources. $100 billion for hospitals, which was a specific ask by the hospital industry in order to support the increase in utilization of services and caring for not only COVID-19 patients, but others that are utilizing hospitals for emergency care, for other vital critical healthcare services. Nearly $30 billion for emergency assistance for schools. That's for colleges and universities, states, and school districts, as well as nearly $25 billion for food assistance. And that includes nearly $16 billion for SNAP. So again, an increase in SNAP and food stamps, as well as $9 billion for child nutrition programs. And then there was also additional resources provided to establish a COVID-19 telehealth program. It's important to note that the issue of telehealth and the utilization of technology to provide healthcare via these virtual environments is receiving far more attention, given the limitations of physical distancing that many of us are obviously experiencing in order to flatten the curve. And this specifically was intended to help eligible healthcare providers purchase the necessary telecommunication services or information services and devices necessary to provide care through telehealth technology. Again, and this was whether for the treatment of coronavirus or other health conditions during the coronavirus pandemic. Right now, as Congress is working on a fourth package, there is interest in ensuring further supports are available to meet the needs of children and families. For example, further expanding unemployment insurance, providing additional support for food stamps, again, recognizing the importance of food assistance during these times. Child welfare system supports, given that the previous packages did not prioritize the child welfare system and ensuring that the necessary supports were provided. Better paid leave provisions, as well as closing the homework gap by providing devices, Wi-Fi hotspots for students who lack internet access, really thinking through what is left to fill these gaps that many families across the country, across California, are experiencing. Congress is on recess until April 17th or later. So there is discussion around when Congress will reconvene in order to move forward with this fourth emergency package. Each of these packages are each a step in the right direction to combat, the health and economic crisis caused by COVID-19. But as I'm sure many of you know and see in your communities, it's Congress and states that really must take additional steps, crucial steps to support children and families in these times. And that's what we're seeing here in California. So in California, we saw that Governor Newsom quickly declared a state of emergency early on in the month of March and worked with the legislature to pass an emergency bill that does provide up to $1 billion in resources in order for the state to respond to this global pandemic. And that really did allow the resources to support hospital capacity, purchasing the necessary equipment that health providers need to protect themselves, providing services for people that are isolated in their homes, or to push back against this housing crisis that too many Californians are experiencing, as well as supporting, childcare facilities. This has been, over the past few weeks, there's been multiple executive orders issued by Governor Newsom, as well as various actions on behalf of the administration that really try to support Californians during this crisis. Making sure that we ourselves are physical distancing, but that we're checking in on our loved ones, particularly older adults in our lives, that we are supporting the necessary medical supplies in communities, again, focusing on supporting childcare facilities, especially considering that many families who are working in healthcare facilities may have children. Telehealth and really calling attention to the importance of telehealth and the availability of telehealth to continue utilizing healthcare services to take care of ourselves. As the Surgeon General stated, how can we make sure that we're taking care of ourselves so we can take care of our young ones? And then various executive orders and actions related to consumer protections, whether that's rent or price gouging and other actions, really stepping up and making critical decisions in a timely way to ensure that we are as strong as possible in pushing back against this global pandemic, and again, flattening that curve. Over the next few weeks, it'll be an interesting time as we prepare for the state legislature to reconvene, right now scheduled for May 4th. It was previously scheduled for April 13th, and that was pushed back to May 4th, given all that's happening. And we are slated to see the legislature discuss the budget and identify what is going to be included in that budget moving forward. So May 4th is the next date that we are considering for the state legislature to reconvene. In addition,
Can I interrupt real quick?
Oh, of course.
I apologize. This is Jeremiah. We're getting a little bit of feedback from the team that the slides are a little small. I don't know if you're able to go out of presenter view and just to the slide view. Maybe that'll make them bigger.
Let's try that.
Yeah, if you're open to that, that would be great, I think.
Absolutely. Play from current slide. How's that?
Yeah, that'd be great. Thank you very much.
No problem. Great.
All right,
Okay.
back to you.
Sure. So oh gosh, sorry, it's so sensitive. Okay, so the other piece about state policy updates in particular is really seeing that there are a number of other pieces of guidance and bulletins that are being issued by the agencies. Our Department of Education, hand in hand with Health and Human Services, issued guidance around district distance learning opportunities. Healthcare Services has not only issued important guidelines related to the telehealth expansion, for example, through Governor Newsom's executive order, but has also submitted an important emergency waiver request through an 1135 waiver. And that's specifically seeking certain flexibilities from the federal government to more effectively provide care via telehealth. This is particularly important given the necessity to utilize technology during this time of physical distancing. We know that the Centers for Medicare and Medicaid Services have approved specific flexibilities for telehealth, and we are encouraged by that. So really are looking to see that implemented here in California and really also raise awareness around the utilization of telehealth and the availability of these services. This is particularly important for many families who may not be aware that utilizing technology to see a healthcare provider, to see a counselor, to talk about your mental health is available to them. How can we ensure that our most vulnerable families can utilize technology to keep their health as a priority? So want to ensure that that does happen. Related to that, there were key telehealth policy changes that were announced. In particular, the Office of Civil Rights at the Department of Health and Human Services at the federal level announced that some flexibilities regarding HIPAA compliance and ensuring that services that many of us use right now, Zoom, Skype, Google Hangouts, can be utilized to provide specific healthcare services. So again, providing these flexibilities in order to be responsive to what families need today. I referenced this earlier, but most recently, the governor did issue an executive order outlining this expansion of telehealth and reminding healthcare providers the availability of utilizing telehealth. And then right now we are waiting for additional flexibilities to be permitted through the 1135 waiver process. One specific piece is ensuring that patients that are part of clinics can be connected to clinics from the home in order to, again, take advantage of telehealth during this time. Part of this has been, I think, an eye-opening experience for many folks in the healthcare system, outside the healthcare system, that telehealth is an important tool to use now and in the future, given that the ultimate goal is to address barriers to care, and technology can really provide a critical role in doing that. We commend the governor for his incredible leadership and really recognize that during this time, there are potential opportunities to further support the well-being of children, really considering how schools are critical partners in the provision of health services for many of our communities, whether that is through school-based health centers or school counselors or school social workers. There are a number of assets that are based in our schools. So how can we ensure that we're strengthening the foundation of those assets by connecting technology to families and our education partners? Obviously, in California, the issue of immigration is one that is very connected to the well-being of many of our families, and ensuring equal access to supports for immigrants and their children is particularly important, given that many of our federal initiatives have left out many immigrant communities. Half of California's 10 million children have at least one immigrant parent, and really want to recognize that what does that mean in the day-to-day struggle in these times to ensure that the economic supports, nutrition supports, and health supports are in the hands of everybody that needs them. And then there's also additional areas as far as the economic stability of families, education campaigns, so that as we move forward these important policy changes and initiatives, that families are aware of it and aware of how they can take advantage of these programs and utilize these services for which they're eligible. And really trying to think through how can we as partners in the community ensure that families receive the information in a language that they can read, in a format that's easily accessible to them, so that they may support their families and their children during these difficult times. And in particular around strategies for supporting school telehealth, really thinking through how can this crisis serve as an opportunity to lay the groundwork for the future. As we equip our schools to be able to provide such services via telehealth during this emergency time, is it possible to extend these changes, these investments for the future, given that so many families face barriers before COVID-19 was even here, whether that's transportation barriers, taking time off of work, or others? How can we see telehealth as really considering a tool in addressing those barriers? And beyond that, really considering what is the long-term impacts of what's happening now on the mental health and well-being of our students when they return to school? And how can we make sure we're doing all we can to support schools with that return, so they're that much stronger. And we welcome, you know, the support of those of you on the line and interest. Again, you are our partners in ensuring that what you need when we all go back to not physical distancing, I think forever will be impacted by what's happening. But how can we ensure that we are shoring up our schools to better respond to the well-being of our students, given that you really will be on the front line and taking care of our young people. Finally, and these are available on the resource site that Jeremiah outlined for folks, both through the chat and via presentation. If folks are interested in learning more about telehealth and its impact on young people, please see these resources. There are a number of other resources available on our website, not just for your reading pleasure, but also for distribution to families. We value the partnership that we have with our education partners to distribute materials to families to make sure that they know what they're eligible for. And of course, this is a very important time for all of us. I must remind us to participate in the census. And if folks have any questions or need resources about that, do not hesitate to reach out to us. We're your partners in ensuring every one of our family members, every one of our young people are counted, and hope to be able to be of service to you in ensuring that accurate count. So thank you very much. There's my contact information, and I'm gonna stop screen sharing and hand it back over to Jeremiah.
Excellent. Thank you, Myra, very much. Very helpful for us to have a policy and legislative update. So thank you for doing that. A lot of that could have been new for you as you're out there listening. We thought it'd be helpful to start as a big picture and then kind of zoom in. So presenters, the second presentation that's going to happen, as well as the third, is going to be more practical for you as well as for your students. So please stick around for that. And also to share with you, we're going to extend our question and answer time until 3 o'clock. So if you do have time in your schedule today, and we hope you can stay with us up until 3 p.m. And as you're asking questions, there are pages and pages that are coming through. Thank you so much for your participation. And it's great to see everyone so engaged, even in this kind of media, this medium, right? It can be difficult to stay connected, but thank you for doing that. And just ask, as you are submitting questions, if you could put who the question would be for. So any one of our presenters. And I will share that someone from the Office of the Surgeon General will be communicating for them. So whether it be someone from their team will be here for you. So at this time, I'd like to present the second presenters for us. And that's Dr. Sue Coates and Tom Sopp with the California Association of School Psychologists. Excuse me. Dr. Sue Coates is the CASP Chair on Mental Health and Crisis Consultation and the California Department of Education Student Mental Health Policy Workgroup member and a school psychologist on special assignment for the Baldwin Park Unified School District's K-12 mental health and social emotional learning programs. In 2016, she received U.S. congressional recognition for her work, establishing the first NAMI High School Club in the East San Gabriel Valley, and in 2018, Woman of Achievement from the California State Legislature. And she's teamed up with Tom Sopp, who's also from CASP. He is a school psychologist with Long Beach Unified School District, which is a large, many of you know, which is a large, culturally diverse urban school district. Tom is assigned to the Family Resource Center, where he supports school sites by assessing the site's tiered support services, collaborating with staff on adding intervention services, and providing individual and group counseling services to students, modeling classroom social and emotional lessons for teachers, providing parent training, and leading professional development for the school staff. In addition, he is the Advocacy and Leadership Committee Chair of the California Association of School Psychologists. We're grateful for their time today. They're going to be giving you practical tools to help your students. This time, I'll turn it over to you, Tom and Dr. Coates.
Okay, can you hear me all right, Jeremiah?
I sure can.
All right. Good afternoon. I am Susan Coates, the Chair on Mental Health and Crisis Consultation for the California Association of School Psychologists, and Tom Sopp is the CASP Chair for the Advocacy and Leadership Committee. This is an unprecedented time in our national and world history. We all need to respond and work collaboratively to take care of ourselves and support the needs of our students, families, staff, and communities. We believe we will all get through this crisis with new medical and mental health insights and inspiring stories of dedication, heroism, and resilience. CASP would like to especially thank Wellness Together on arranging this webinar series, and you as an audience for your service to our California communities. This presentation is meant for pupil personnel services professionals and the supervisors of PPS staff on how to support all students during the global pandemic using a check-in model. Please refer to our 3 documents in the resource folder for more information, details, and hyperlinks to resources.
Well, thank you, Jeremiah, for those kind words. And Susan, thank you. Let's get real with the big picture. If you're like me, you started this school year expecting it to hum along like any other school year. And then all of a sudden, things changed dramatically. Like in my introduction, I'm a school psychologist assigned to the district's family resource centers. We know them as FRCs, where we have teams of school counselors and school psychologists that provide individual and group counseling services to students and connect families to community resources. Well, in response to the pandemic, my district has been closed for more than 3 weeks now. Before the closure, I was counseling students with anxiety and depression, students who experienced trauma and loss. I felt like I was abandoning them by abruptly stopping the services. And so in response to that, in an effort to stay connected to students, to monitor students in response to the closures, the FRC staff has been conducting what we call check-ins with students for the last 2 weeks. I want to give a shout out to my valued FRC colleagues. I'm very fortunate to work with such a dedicated and highly skilled team. Because I have only 10 minutes to present on the check-in model, I'll provide some broad strokes on the topic, and the details you'll find in the guidance document located in your resource folder. We describe this as a guidance document, which means to us that it's just a starting point. We encourage you to make adaptations to fit your district's resources, community resources, and your students' needs. And so this presentation is designed to be linear, starting with the big picture, and then examine considerations to discuss before, during, and after, connecting with students. And so starting with the big picture is our own self-care. That was already made known. We need to make sure that we're grounded, and Leora is going to present more on this topic later. Another thing we need to really keep in mind is to support our teachers. Teaching is a challenging profession, and imagine teaching during a pandemic with your own anxiety, and at the same time retooling yourself for a virtual classroom. Your teachers are engaged in a heroic effort, and it's important to not forget that. So check in with teachers as well, making sure that they're supported. I mean, after all, they're building the plane while they're flying it. The FRC has created a list of resources and activities that staff can remotely access and implement for their own self-care. Resources such as guided meditation, self-care exercises, and social and emotional learning activities. The FRC's created a Google Classroom where staff can access these things, these self-care resources, and we've received a lot of feedback from staff that it's been helpful. The other is professional development. Many PPS personnel are already trained in the PREPARE model for crisis intervention, which is a very helpful resource. But if your colleagues start a check-in model, You want to make sure that you have a standardized method and training amongst yourselves so it can be delivered in a very high fashion with high standards. The other is scope of practice is an important point to make mention. You know, due to the effects of the pandemic, families are experiencing anxiety and being restricted to their homes, isolated from friends and or family members. There's financial hardships, educational impact. Students are feeling grief over the loss of the traditional promotion and graduation activities. Supporting students and families in a crisis is within your scope of practice. This is what you've been trained for. I encourage you to rely on your training, stay within your scope of practice, follow legal and ethical guidelines and mandates when working in a remote environment, as if you're working with students in a face-to-face setting. So now let's talk about what a check-in is. So you see a box on your screen. I'm going to read this box and you'll want to follow along. A check-in is a narrow, care-focused process to meet the immediate student family needs, while counseling focuses on long-term goals and a broader range of issues. So we stopped providing counseling. And so our stopgap measure at this point is this check-in, which is much different than counseling. And so a check-in is not meant to be a crisis hotline for students. It's certainly not a social call because we're still in our professional roles. And it's not meant to be a telehealth therapy session. Also, it's not meant to replace the previous counseling, whether the student is a gen ed or a special education student. A check-in is a short phone conversation to see how the student is doing. It's within your scope of practice. It's an opportunity to connect with students and express empathy. It's a method to model, excuse me, not to model, but to monitor a student's stress reaction. And it's something that should be available to all students. And so let's talk about things to consider before you start conducting check-ins. There are some preparation steps to consider. While I review these considerations, think about your district and the site-based leaders that you meet with, because you want to think about who you'd want to meet with to help make some of these decisions and gather resources. The first is, what platform are you going to use? Are you going to use a landline, a cell phone, a virtual platform, email, a postcard? Along with making these check-in phone calls, our FRC team has also created these very nice looking postcards which have affirming messages, and it's just a way for us to digitally email or send through US mail a message to our students to let them know that we're still thinking about them. Parents have been saying that, that students have been really thrilled to receive them. You also want to discuss what's going to be the frequency of the check-ins. The other is ensure client confidentiality. How are you going to do that? How are you going to ensure security of the communication medium? If you rely on your cell phone, you're going to have to consider, how are you going to, what boundaries are you going to set? And maybe check into creating a Google Voice phone number to keep your own personal number private. If you're working from home and your family's present, keeping the conversations confidential might include closing the door, putting up a sign, maybe even locking the door, using earbuds. The other is you'll want to create a list of hotline numbers, district supports, and community resources such as food pantries, housing, health, employment resources. For example, in my contacts with parents, many of them don't have a paycheck at this point. And so I've been supplying food pantry information to many families. You might be in the position, you might have to do the same. Also, before the situation arises, you'll need to create a response protocol for working with a student who is significantly stressed and for managing at-risk situations such as suicidality. So you may want to start reviewing your district's suicide assessment form and protocol to determine if it needs to be modified for a remote access scenario. If they do not have a protocol for this unique situation, you may want to offer to work with your supervisor on developing a safety protocol. If you're working from home, you want to make sure that you have these emergency response agencies' contact information with you. In the last 2 weeks, while we're conducting check-ins, we've conducted 2 suicide assessments. Feedback from one of our assessors is, be prepared to conduct the suicide assessment without the visual cues one has from a face-to-face setting. The other is just to make sure you have those hard copies with you, already printed out before you conduct the check-in, just in case it turns into a suicide assessment. The last thing to consider before you start check-ins is triage. Your team will want to discuss, well, first of all, who's going to conduct the check-ins, who's available, and how are you going to triage your students for the check-ins? Who are you going to prioritize? Who are you going to contact first? Listed on the slide and in your guidance document are examples of groups of students you may place at a high priority to reach out to first. The other is you need to determine whether the student is capable to participate in a check-in, such as, consider their cognitive ability, their developmental level, their verbal skills. You might find alternative ways to connect with those students. And so when you think about the delivery of the check-in, this is how it would proceed, is that you would first contact the parent or guardian first, share the purpose of the call, and build rapport. If examples are helpful to you, there's some prompts in the guidance document that you can review. You want to obtain verbal consent to conduct a check-in with the student before you talk with the student. One of my colleagues shared the story that she was talking with a parent who said she has 5 children, all school age, all at home, and the parent was overwhelmed with managing the technology, and just the daily routine of everybody being at home all the time. And so that was a good opportunity for her to give resources and a great opportunity to consult with that parent. And so after you, and for safety purposes too, you'll want to ask where the student is located. My experience has been that sometimes, parents will just hand the cell phone over to the student who's just right there. Other parents will give me or provide to me the student's cell number. But I was talking to a parent working from home, and that, given the nature of the parent's work and the home environment, during the week, the student lives with a relative. And so I said, for safety reasons, will you provide me the location's address and the name of adults who are there with your student, before I conduct the check-in? That's a really important thing to note. Especially if things kind of go sideways and you find yourself conducting a suicide assessment. You'll kind of want to know the address and phone numbers and the adults there. Assuming that the parent gives you verbal consent, then you're going to be talking with the student. And then after you introduce yourself and make clear you're kind of still in your professional role, obtain verbal consent from the student to have the check-in. Can I talk with you now? Is now a good time? And if your district isn't, if your district is offering virtual learning options, ask the student about his or her learning experience thus far. And if needed, provide district information on remote learning opportunities or how to get that technology support. Ask the student about his or her daily routine. What are they doing during the day? Do they have a regular routine? Ask about social support systems. Are they continuing or remaining to stay in contact with friends and family? Encourage them to ask questions and to share their feelings. Provide empathy for their experience. One of my students has a parent who's in the medical field, and she tested positive for COVID-19 and was experiencing symptoms. And so she had to quarantine herself at home, which was kind of a weird experience for the kids. I mean, it's just weird because they cannot see their mom even though she's home. And it was weird too that they were just scared of the situation. She's infected, she has symptoms, what's going to happen? And so, that was a great time to empathize with their experience. And I just want to share the good news is that she's recovered and no longer in quarantine. But what if the conversation grows into the short conversation grows into a long conversation? If the student is significantly stressed, consider using the PREPARE model for crisis intervention and global pandemics as a framework for speaking with the student. Dr. Brock has tweaked the framework to fit the global pandemic, and that resource is available to you in the resource folder. If the student reports suicidal ideation, you're going to follow the district's modified suicide assessment form and protocol. I encourage you to check your LEA's policies and procedures regarding suicide risk and assessment during a remote contact. And so afterwards, after the check-in, document that the check-in occurred in the appropriate confidential area of the LEA's student information system. Determine if there's a need for follow-up to the check-in. Or maybe the student needs to be enrolled in a social or academic instructional group that your district might offer, or refer the student to telehealth sessions. It may be helpful to follow up and see if the parent's needs if the parent needs support for navigating the provided referrals. And so kind of in transition, well, let's transition to your LEA. Here are some questions to consider as you process this, what it might look like. Are you doing enough, first of all, to take care of yourself? What students would you prioritize for check-in? How will you adapt the documents to meet the needs of your students? And what resources do you need to gather? What are your next steps? So in closing, the big picture is that the school year has taken a sudden left turn. Collaborate with your colleagues to create a plan that works for your students. Through my work with CASP, I have the opportunity to talk with professionals across the state. And I know how hard you are working to support your students during the school closures. And because I appreciate your hard work and your dedication so much, I feel the need to give you something before I go. During times of crisis, some people find comfort in having animals around them. Like some people, enjoy dogs. Other people enjoy cats. If you're my daughter, Brenna, you have one under each arm. But I think it's safe to say that everyone can find comfort from a baby duck, regardless of whether you prefer a dog or cat. And so I give to you baby ducks. So thank you so much for your participation. And now that we know that school closures will continue for the remainder of the school year, many districts are looking ahead, researching telehealth options to provide counseling services. I know some districts will start providing telehealth counseling services before the end of the school year, this school year. Dr. Coates will now introduce a checklist of considerations when establishing a telehealth option.
Thank you, Tom. Please take out the school telehealth services checklist for the next 2 slides. It will provide more detail as we move from a quick check-in model to a more long-term counseling approach. The Health Resources and Services Administration of the U.S. Department of Health and Human Services defines telehealth as the use of electronic information, telecommunication technologies, social distance learning, patient and professional health education. Technologies include video conferencing and so forth. The National Association of School Psychologists define telehealth or teletherapy as where the clinician and the client are physically and remote from in different locations, and virtual services are provided remotely using technology and the internet. HIPAA, or the Health Insurance Portability Accountability Act, ensures that healthcare providers implement multiple safeguards to protect sensitive personal and health information. Simply put, HIPAA protects both the private mental health provider and the client's medical and mental health records with integrity, confidentiality, and availability. FERPA, or the Federal Education Rights and Privacy Act, is a federal law that protects the privacy of student education records. This law applies to all schools that receive funds under the U.S. Department of Education. Elementary and secondary schools are protected under FERPA. Mental health professionals that are employed or covered by a school district are covered under FERPA, not HIPAA. Now, local educational agencies that receive federal funds are not covered by HIPAA, but under FERPA. So it's important that the technology platform used during telehealth services for students be FERPA compliant. Minor confidentiality rights and restrictions are the same in the remote setting as in the face-to-face setting. You must get a parent or guardian's permission for youth to receive ongoing counseling support. Restrictions to confidentiality rights refers to mandated child abuse reporting laws and intervening in the event if the minor reveals a threat to themselves or others. Informed consent forms are not required for virtual check-ins, but are required for ongoing counseling sessions. During this national pandemic, PPS professionals now find themselves replacing their in-person student interactions with virtual telehealth services using their LEA's technology platform. This checklist is meant to provide the PPS staff and their supervisors with thoughtful guidance as their mode of communication with students change. This list is not meant to be exhaustive and will rely on your LEA's guidance. First of all, ask yourself, is telehealth services appropriate for your student? Tom mentioned this. If your student is capable of engaging in telehealth communications, consider their developmental level, their verbal skills. For example, if a student has a verbal disability, you may need to collaborate with the parents or other adult family members while working with the youth. Some students may have a landline or cell phone, but do not have a computer device. Many districts have free internet resources for students and are lending out iPads or Chromebooks to students who don't have computers at home so they can engage in distal learning. Internet quality and device availability will guide your mode of communication. Is your district supportive of telehealth? On what type of device? Do they provide trainings on the technology or the internet platform you'll be using? Is the technology platform FERPA compliant? Before your interaction with the student, consider if this is going to be a quick check-in, individual or group counseling. Remember, a check-in doesn't require informed consent, but telehealth services suggests ongoing counseling services, and that requires parental consent. Consider adding some comments about telehealth format on your existing informed consent form. Just as Tom mentioned, it's extremely important to know your district's remote crisis plan in the case of a student emergency. Have your resources ready, hotline numbers, agency and clinic numbers, your district staff names, emails, phone numbers, if they handle certain students and family supports. In your first session with the student, confirm his or her location and phone number. Tom talked about that, how important that is. The student may be in a different location during the day than the parent. You need to know who they are with and where they are in the case of an emergency. Have the student's other emergency contact numbers ready if you cannot get a hold of the parent. It's important to review the importance of privacy, confidentiality, and security of your telehealth session, both with the parent and with the student. This is not only important for you, it is now at work, you may be working out of your home and you have children at home. You need to make sure that the student also can be able to be in a quiet place where others are not listening on the confidential exchange, interrupting or distracting the focus of the session. Overall, be the same person you are in the remote telehealth session as you are in the face-to-face session. Be authentic and be professional. Thank you.
Dr. Coates and Tom, thank you both very much for not only reminding us of the role that we have in students' lives, but equipping us and empowering us to continue serving students in this new landscape. So those checklists and those supplementary materials are available in that bit.ly, that resource folder, bit.ly/supporting you, supporting students. And I think I speak for thousands of us, Tom, when I say thank you for the baby ducks. I think we all kind of let our shoulders down for a little bit and enjoyed a little bit of positivity and a distraction from some of the very hard work that all of us are doing. So thank you both for that. So we began at the federal legislative level, at policy level with Myra and the Children's Partnership and the great work that they're doing. We went to helping your students with both Dr. Coates and Tom with California Association of School Psychologists. And now we're zooming in to you as an educator, as a district leader, as someone who is serving students. And I'm very pleased that Dr. Leora Wolf-Prusan is here with us. A real quick introduction for her, and then Leora, I will turn it over to you. Dr. Leora Wolf-Prusan is the Director of Partnerships and Learning at the Center for Applied Research Solutions, where she supports the agency's teaching and learning portfolio. She serves as the Region 9 School Mental Health Field Director for the Mental Health Technology Transfer Center, MHTTC, in addition to many other facilitation projects. Her previous roles include, but not limited to, a National Field Director of the SANSA Initiative, technical assistance for the Student Mental Health Program for California's community colleges, CalWorks, and more. Before joining CAR, she served as a school climate and student support specialist in WestEd's Human and Health Development Program, where she provided consulting and training. Prior work also includes serving as an educator coach and consultant in a variety of education settings. This includes Oakland Unified School District, Los Angeles Unified School District, and other large urban LEAs. And her primary focus was on college and career-going culture in urban high school contexts. She received her bachelor's in international relations and in Spanish with a minor in social and ethnic relations from the University of California, Davis, a teaching credential from Mills College, and her ed doctorate in educational leadership from the University of California, Los Angeles. We're so glad to have you, Leora. Thank you for being here.
Thank you. Now everyone knows all my things, so I'm so glad, to be with you. Well, I just want to take a breath. It's been, there are so many of us in conversation this afternoon, and there are many of us who've been sitting for a little bit and receiving a lot of information. So I just want to take a breath for myself and also for all of us. Let me actually just do that. I'm going to encourage you to kind of move shoulders or roll neck, as whatever you need to do. I'm really big about learning segments being 20 minutes and then having some sort of way that our bodies can help us integrate all the learning. And both Myra and Tom and Susan have provided so much before me, so I'm really grateful. Again, my name is Leora. I use the pronouns she, hers. I'm based in Los Angeles, California, a rainy day here in LA. And I get the pleasure of talking about us, talking about caring for caregivers. I think I used enough C's in this title, Caring for Caregivers, Cultivating a Culture of Collective Care. And partly what I'm hoping to provide space for in the next 20 minutes is to affirm and acknowledge all that we're holding and navigating, maybe provide some new language that might just reflect what we're experiencing, but having a term for it might help us identify some of the ways that we can move through it and with it. And then also shift our concentration from self-care to collective care. So all that to say, I'm actually here under the hat of the School Mental Health Lead for the Pacific Southwest Mental Health Technology Transfer Center. We're funded by SAMHSA, the Substance Abuse and Mental Health Administration. I promise you that's as many acronyms as I'm going to try and use in the next 20 minutes. And so we're grateful for funding, and this presentation is through SAMHSA, but not of SAMHSA. Last but not least, as an intro, lots of tiny font here. The only thing that I want to introduce is that number 9 right there is the region that we serve, the US Pacific Islands, Hawaii, California, Nevada, and Arizona. And so if you're a school mental health provider, and that means teacher, school psych, school social workers, principals, educators, district, LEA, etc., that is what we are here to do, is to support you in the work that you're doing. So all that to say, I want to just name that one of the phrases that I've been saying over and over and over again is always and now, because so much of this work and so much of the work around self and collective care in our education systems is heightened in this moment, but also is work that we can be doing always, particularly because there are many of us on the line who, yes, this is a big crisis, but we've also been navigating education environments, contexts, and experiences that are also crises. I know that, for example, the reason that I came into this work is because I lost many students due to gun violence. That was and still is a crisis. And so many of us have grief wisdom. We have crisis wisdom in our bones as educators. And so part of the work is figuring out what are the practices that we can always do. And in this moment, what are practices that we might need to prioritize in order to really help us not only serve the students that we're supporting, but also serve ourselves and our colleagues. So just wanted to note that piece. And the other piece that I wanted to name is that I'm going to be using the word educator. And I just invite you that even if you don't maybe identify as an educator, I'm going to kind of use that as an umbrella term for all of us in conversation together. The other piece that I want to affirm is that this pandemic and shelter at home and transition to tele-teaching and tele-educating and telepedagogy happened in a time in our school year that is already compressed. Like March is a really hard month for a lot of us anyway. And so we might have already been on low reserve, and then we were moved into a completely new space that's blurring the professional and the personal all in one moment. And so I want to name that many of us have been using like, oh, well, now we're at distance learning, we're providing, teaching at home, we're providing virtual teaching. And I just want to suggest, as many others have, that this is actually not virtual education. This is teaching through triage. This is teaching through crisis or providing counseling through triage. And while there are staple principles of practice, just like Tom lifted up and Susan lifted up, that we should always be doing, there are certain pieces right now that we either are going to step even further into or less into because of this moment. Okay. So all that to say, the other piece that I want to name is that there are many dualities that we're holding on to right now. Like I know that some of us have too much space and some of us have not enough space. Some of us are too connected and some of us are not enough connected. Some of us are too essential and some of us are not essential. Do you see where I'm going? There's a lot of dualities that are happening. Some of us, as Dr. Nadine Burke mentioned, some of us feel safer at home and some of us feel even less safe at home. So all of those dualities are complex navigations that we are either consciously or subconsciously navigating. And I want to name all of that balancing act that many of us are holding in the minutia minute of our days. The other piece that I want to lift up is that many of us might be experiencing grief. Many of us might be experiencing stress. Many of us might be experiencing loss. Some of those things are connected. And also some of us might not be experiencing any of that. And we're actually just moving through the day. So every single experience that you're having is an okay experience. And part of what our work to do as educators is to think about how do we not decide what someone else needs to be going through? And how do we just let what we're going through be what it needs to be in that moment? And that matters not only for us, but also for the young people that we serve. Okay. So just to ground us, I'm a big fan of Dr. Gabor Mate. I hope all of you join me in being his student. And he offers us this idea that stress, which is something that we all experience and is a continuum, both positive and negative, or adaptive and maladaptive, is a response to any threat. And that some or perception of threat, right? And that is actually the key piece in this time that feels so wonky, because some of us are actually experiencing it and some of us are feeling it and we don't even know why we're feeling it. I want to name that the Mental Health America survey of 2017 found that the two professions that had the highest level of burnout and stress were healthcare professionals and teachers. And that was in 2017. That wasn't even right now, right? So we are frontline providers no matter what, always and also now. And so what Dr. Gabor Mate offers us is that there's 3 pillars of stress. There's the actual stressor, which maybe could be the pandemic, maybe could be the shelter at home, maybe could be trying to have to teach and find connection with students that we miss through our computers. Or it could also be the processing system, so how we're understanding this moment, our ecosystem, the skin that we live in, our racial identity, our gender identity, our sexual identity, our age identity, the social ecology of who we are. Because of structures of both healing and harm, we have really different responses to healing and harm, and we have really different access points to healing and harm. And then the third is, of course, the stress response. So I just want to take a moment for us to identify that in this whole kind of bucket of stress, there are those 3 things. There's the actual stressor, there's how we're processing the stressor, and then there's how we're responding to it. So all that to say that in this balancing act, when we're talking about dualities, right, I'm doing this and also this, that there's both exposure to suffering, what destabilizes us, and also buoyancy, like what helps us regulate and regenerate. So on the destabilizing side, we might be experiencing compassion fatigue and sorrow, which is when we can't really identify what the source of the wear and tear is, but we know that, that we are having a harder time accessing empathy for others' experience of suffering. And usually our loved ones are the biggest folks who can tell us if we are experiencing compassion fatigue or not. The second piece is this idea of vicarious trauma, that many of us might have an overwhelmed coping system, not because something happened to us, but because something happened to someone else. And we're actually experiencing a global, potentially a global experience of vicarious trauma right now. The third is this concept of burnout, mental exhaustion. And I just want to name that burnout really is kind of this, again, this soup of both exhaustion, effort, and efficacy. And it's really important to name that some of us might be experiencing chronic exhaustion because we're in the work, but it doesn't mean that we're experiencing burnout because we feel efficacious, we feel in charge of the work that we're doing and we have choice, and we also feel like our efforts are affirmed. It becomes burnout when those 3 E's come into place: exhaustion, effort, and efficacy, when those are feeling depleted. The other piece the other aspect is moral stress. And I just want to name that moral stress is a term from Francois Mathieu. And Francois Mathieu offers us that moral stress is this idea that we feel stress when our leaders do something that we feel is immoral, or our leaders do not do something that we feel is moral. And that actually biomechanically and biophysically internalizes in the exact same way that any other physical stressor or external stressor might be. And so that piece is really important for us to be clear about, because if we are a principal, administrator, leader, etc., it means that actually we have great task in both preventing, interrupting, and being in some dynamic process checking if we're contributing to moral stress. On the other hand, right, so there's that's all that. And some of you might be like, oh yes, that, and that, and that, and that, all those things. And on the other hand, we also know that we have the ability to get great compassion satisfaction from those around us. Just like a virus is contagious, so is compassion and empathy. We also are able to deeply pick up on other people's vicarious resilience. So we're experiencing vicarious trauma, we're also experiencing vicarious resilience. I know personally, I learned deeply from my students about what to do and how to build resilience when one of their peers died, when I had never experienced a loss of a student before. The second to last term is something that you may have heard of before. It's this idea of neuroplasticity. It's this idea that our brain is wired for healing. Our brain is wired, literally wired. We are literally given neurosynaptic architecture to rebuild, repair, and heal. And so our bodies are waiting for us to get to that point where we want to heal and regenerate. And the last piece is this idea of hope match, which is really important. And it has to do with balancing out that burnout, that many of us find deep buoyancy when we know that what brings us joy and hope and motivation is matched in our workplace. So the other piece that I want to name is that while stress might be individual, burnout is deeply organizational and collective. And that's why it's important to talk about the both and, the self and the collective. And so I just want to take a moment to kind of think about like, what is most important right now for us as leaders and for us who are supporting team members. So if we are asking people to take care of themselves, what that means is that we also then need to create the policies and practices and programs that will allow that self-care to actuate. So if we're asking people to access self-care and at the same time expecting them to continue with their standardized curriculum, we might actually be contributing to moral stress, right? So the question is right now, what is the most important piece to manage? Is it standards or is it connection and relationship? Okay, all that to say that, that one of the biggest pieces in education, always and especially now, is that we have some room to grow in our understanding of grief in teaching, grief in education. That all of us are in this profession because we deeply believe in relationship. And so part of the question is like, what happens when the other person on the other side of that relationship is gone in all the ways, emotionally, physically, spiritually, etc. And so Naomi Remen offers us, and this is in Francois Mathieu's Compassion Fatigue Workbook, she offers us this quote. She says, "The cost of caring, the expectation that we can be immersed in the suffering and loss daily and not be touched by it is as unrealistic as expecting to walk through water without getting wet. This sort of denial is no small matter. The way we deal with loss shapes our capacity to be present to life more than anything else. The way we protect ourselves from loss may be the way in which we distance ourselves from life. We burn out not because we don't care, but because we don't grieve. We burn out because we've allowed our hearts to become so filled with loss that we have no room left to care." And so part of this moment that I'm inviting us to think about is that this work of caring for caregivers is actually very hard. It's rigorous and it's tough. And many of us might invite ourselves into growing in the skill set of holding space for those who are going through deep pain and allowing us as professionals to actually blur the line even more so that we can be people in our profession. Okay, a couple more things. So you've all seen this. This is the great metaphor. Put on your oxygen mask before you're able to help someone else. I think that's fine. I just want to root us that actually the term self-care is deeply political, not necessarily in a capital P, but in a lowercase p, meaning that the idea of self-care and burnout actually stem from post-Vietnam era when psychologists were experiencing vicarious trauma, vicarious stress from serving veterans, and they also didn't feel like they had the skills to support the needs that veterans were coming to them with. Self-care came from that, right? So it's coupled deeply with burnout, and it also came from the 60s and 70s civil rights and human rights and social justice movements. So I want to name that self-care is actually a deeply human right, and it didn't originally mean what it has come to mean today. Self-care literally meant that the do no harm adage means that anyone serving another person needs to be served. It didn't mean, as Francois Mathieu says, eating kale and getting manicures. It actually meant that organizations and systems understood that there's a ripple effect in care provision. So all that said is that I'm going to ask us to really think about, okay, yes, to put on oxygen masks so we can provide oxygen for other people, but also, what if we actually looked at the whole plane, the structure and the culture and the practices, so that the onus of regeneration and of maintenance isn't on the individual, but is actually on the collective. So all that to say that when we think about care, and this comes from many different people, and the citations, you'll get this in your notes, that there's many different ways that we can access care. We can do it, we can access it financially, physically, professionally, personally, emotionally, spiritually, psychologically. And that means not only providing, again, it for ourselves, but also for others. And you'll see that I provided a couple examples in each bucket. You'll also see that many of them actually speak much more to policy, not just to individual practice. So what might this mean for us? And again, I really want to be clear. I'm not suggesting this as do this now. I'm suggesting these as invitations for when you're ready, and potentially if you are leaders to think about how to move into this work for the always and now. I think many of us are involved in a lot of conversations every day that involve people giving advice. So I'm just going to offer these as practices, and you might step into them or you might step out of them. So the first is that practices that support that support us on the peer and collegial level. We might establish support networks, that we might seek support. That means that support seeking can't be shamed. There can't be stigma around asking for help. And it actually means that there is affirmation from our district leaders and school leaders and administration and managers of help seeking. But that's actually part of being a good professional. It might mean that we start to institute debriefing so that we're not alone for 8 hours on the computer all day, but we're actually pre-briefing, debriefing. And again, of course, there's that difference between emotional vomit and debriefing, when you just turn to someone and you say, about my day, but actually having someone to help you make meaning of what's going on for you. The piece about debriefing that I want to just double click on really quickly is that debriefing can be both in affinity. So it can be school social worker to school social worker, someone who identifies as queer to someone who identifies as queer, or across difference, superintendent to principal to teacher. And part about thinking about debriefing is being strategic about what space needs to be held for which conversations and what is going to make people feel most safe to debrief. You'll see that there's also a lot of other suggestions. The last one, of course, is create and communicate boundaries informed by our needs, not by our actions or feelings. That's part about creating space. You'll see that in the middle too, there's also this identify areas of professional inquiry to get trained in boosting your competency. And again, that has to do with preventing burnout or interrupting burnout if we're not feeling efficacious. So if you know that your teaching staff has really never taught through computers before, we might need to pause and actually do some Zoom 101 or Adobe 101 or Google Hangout 101 and get the technical before we get to the pedagogical. And that is collective care. If we move into organizational, I just want to lift up that, again, these are just suggestions, and many of you will have many, many more that you've already been doing and especially now are doing. I want to encourage folks to not only provide support to students, but also support a structural check-in with educators. And again, I'm using that term widely. And then also to schedule checkups. And I want to be clear that sometimes checkups and check-ins, just as Tom was mentioning, are not actually about evaluation or supervising. So if you're a supervisor and evaluator and you're asking one of your teachers or school psych students to check in with you, there may not be a safety place because of that power differential. So again, that's why thinking about what groups need to be in affinity and what groups need to be across difference is really important. And then the last piece is that I'm just going to name, because I talked about speaking from boundary before, that also if we're at the organizational level, we have to respect and model our boundaries. So if our staff is saying, I actually can't do that, and here's why, then we need to be, we actually have to have some elasticity with saying, tell me why, and let's adjust to meet your needs, right? And that actually is a big, big equity social justice issue for many of us on the line who are being asked to do work that we actually literally can't do because we're caring for other folks in our homes right now, or we're trying to maintain our own physical presence. Brittany Packnett-Cunningham says that we're all in the same storm, but we're on really different boats, right? So some of us have different resources because of how we understood the concept of stress. Okay. So I'm going to close with one more minute, and that is that I want to just suggest that we might sit in more reflection than in doing right now when it comes to self and collective care. So I just want to ask you and invite you to take a moment to reflect. So wherever you are, which question resonates with where you and your team might need to go, not only for the well-being of your students, but the well-being of you and the well-being of your colleagues, right? So what might look different? What could you be doing more of? How might you respond to requests differently? How might you make requests differently? And how might we actually make regulation, relationships, reflection, and renewal the priority of the time right now, which again, might be an always staple, but especially for right now. So all that to say, we really believe that this work happens in concentric circles of care. So if we want all of our students to come ready to school and learning, then we have to prepare and support our teachers to come to school, virtual or not, ready to teach. And for school leaders to arrive to school, again, virtual or not, ready to lead. So it's this concentric circle of care to start for us to not only think about, but also really institute policies, practices, and programs that support all the people, all levels. Okay, last but not least, I'm in love with this quote from Susanna Callahan, who says that our minds have the incredible capacity to both alter the strength of connections among neurons, that was that neuroplasticity that we were talking about, essentially rewiring them and creating entirely new pathways. It makes a computer, which cannot create new hardware when its system crashes, feel fixed and helpless. So my friends and my colleagues, I just want to remind us, we are not computers. We are using computers in a triage moment that might help us identify practices that will carry on through the always after, or simply respond to the needs of now. So all that to say, you are human, you're allowed to have a human experience, and part of the ask of this time is to think about how to do that, not only at the self, but also at the organizational collective level. Lastly, Jeremiah, I'm cueing you because I'm going to stop soon. I just want to mention that our Pacific Southwest Mental Health Technology Transfer Center, we have a slew of offerings, particularly our Wellness Wednesdays, which just center you coming in and checking in and having your own space. And we also have a lot of webinars around grief and response, commemoration, memorialization, and planning for school crisis during crises. You'll have that all in your box. I'm so grateful to have been here with you. And with that, I close. Thank you, Jeremiah.
Thank you so much for holding that space for us all and for inviting us to really to accept some of the things that are happening around us, no matter how challenging or troubling they might be. I think it's particularly helpful, all those resources there at the end, and they will be available in the resource folder that we have under Dr. Wolf-Prusand's folder there, bit.ly/supporting you, supporting students. So a few things before we continue. I would like to offer that before you leave, you're still invited to stay with us for the next 10 minutes for questions, but I would invite you to leave your feedback at wellnesstogether.org/feedback. And in addition, there's some questions that we, along with in partnership with the CDE, would like to know. What are some of the biggest needs you have right now? What would alleviate some of that stress? And what topics would you be interested in as we move forward and offering these kinds of trainings? So please visit wellnesstogether.org/feedback to let us know that. A couple things regarding the questions. Number one, we're seeing several of you are asking, how can we advocate for more mental health support, so more PPS staff at our sites? How can we do that? I'm delighted to tell you we have a last minute addition, and the Executive Director of CASC, Loretta Woodson, the ED of California Association of School Counselors, will be joining us next week. And she'll be discussing just that. How do we advocate for more mental health supports, for more PPS staff for our students, especially in a time like this? So you will not want to miss that. And again, all these will be recorded. So if you have other meetings or other calls to make, then you'll be able to catch that. Next, before we go in, I'm going to actually kick off questions with the Office of the Surgeon General. There is a representative, Jana Olsen-Morgan, will be speaking on the team's behalf. And Jana, the question I have for you, thank you for being here, by the way. Thank you for your time. We certainly appreciate it.
Yes, I'm very glad to be here. I know Nadine was sorry that she couldn't attend for the duration, but I'm really happy to be here.
Yes, great. Well, I'll ask the first question here for you. And that is, as school psychologists and leaders in school settings, how do we get involved in the initiative for screening youth? And will there be opportunities for school psychologists to work collaboratively with this statewide initiative?
Yes, no, I'm very pleased to hear the question. And as a reminder, that's the ACEs Aware initiative, and you can find it at acesaware.org. And in the short term, I will put my email address, and I'd encourage anybody who's interested to shoot me an email. So after I finish answering the rest of the questions, I'll pop that email address into the chat function. And also Jeremiah is welcome to distribute it later.
Excellent. Thank you. And then one more actually for your team. And that is, are there any videos you would recommend we use for teaching the strategies you mentioned, or that Surgeon General Burke Harris mentioned in the playbook for children when supporting social emotional learning? And this individual says our TK to 5 students would enjoy videos, and also those for parents for more languages than just English.
Yeah, and just as an important sort of piece of news, our stress management playbook, I'll also put a link to that playbook in the chat function, but it can be found on COVID-19ca.gov, and then by navigating to stress management on the menu on the right-hand side. That playbook aimed at caregivers and children will be translated into various threshold languages, and I'm told that that will happen rapidly within the next sort of 72 hours or so. As for videos, we have a couple of videos that I'll include in the resource documents, which include Dr. Burke Harris giving interviews about how to talk to children about COVID-19, which is, I want to acknowledge, is a little bit different than what the questioner was asking, which is really, are there videos around helping children deal with their stress? And so I think that's also a really good prompt for us as an office. And so I'll do a little research on the back end. If we have those already in the can, I will distribute those through Jeremiah. And if not, it's something we'll take back and think about what we can do to be supportive to all of you doing the great work.
Excellent. Thank you for that. And I'll be sure to upload those into the resource folder for everyone. Thank you for that. The next question is for Myra with the Children's Partnership, and would love for you to take the lead. If there are any others here on the panel this afternoon that would like to add their thoughts or from their perspective, that would be great. But Myra, this question, this individual asked, they'd like to know more about any resources that would help students and families to receive the free internet coverage. I believe there's a few larger companies that are able to offer that. Could you share what you do know from your work, and then others on the panel can also add in something if could be missing?
Sure, absolutely. So one of the things that we do know is that many of the private companies have on their own presented the opportunity to offer mobile hotspots or free internet for 60 days. Companies like Spectrum and Comcast have extended these opportunities. And then in the 4th legislative package that's currently being considered by Congress, or currently expected to be considered by Congress when they reconvene in later on in April or a little bit later, internet access and the opportunity to have broadband access is something that is being prioritized in order to ensure that these opportunities for telehealth, for distance learning, are not exacerbating the disparities and inequities that we know exist already. So this question actually is informing me that perhaps we need to create some sort of a resource that allows folks to know in short order what sort of specific resources are available for families. So I will definitely take that back and either do some work to figure out if it already exists, because we have many partners in the technology space and advocacy space that may have already created that. And if so, we'll circle back with Jeremiah to include it on the resource bank. And if not, make sure that we can create something like that to be in service to people that need it. And if others have specific information to share, please do.
Great. Is there anyone else on our panel today that would have, maybe in your particular region or area of the state, that would have anything to add to what Myra was saying? You can check the chat thread as well. I don't see anything. Okay. This question is for Dr. Coates and for Tom. And if you two can maybe take the lead on this, if there are others that would like to add, please feel free to do so. And part of the check-in protocol that you discussed, Tom, in that checklist was talking with parent or guardians first. And what options are there for contacting students over 12 that they've already consented to their own services, whether for counseling, so there hasn't been parental consent, but they've given consent themselves. What would a check-in look like for a student in this particular situation?
Wow, that sounds like a great question. We get written consent for all of our counseling services for students, and so we already have that consent, but we felt it was necessary to talk with the parent directly. That also gave us a context for what was going on in the home. And so, you know, if we didn't have the written consent, that's why we want to do the verbal consent and document that you know, we had done that before we contacted the student. Susan, do you want to add anything to that?
Well, remember the check-in is, we're trying to care for all of our students right now. It's a time to say we're going through as staff and trying to make sure everyone's okay. What resources do you need as a family? What are you experiencing? How can we support you? How can we support your children? So I think in that conversation, it shows the care that we have, and we're trying to do that reaching out. Now, if a student has been receiving services, and they can over the age of 12, there are circumstances where they can do it, and maybe they've been receiving counseling support without their parent knowledge. Just like a medical visit, you can go to a medical clinic and do that if you're above the age of 12 and not, your parent is not aware. It's the same thing with counseling. It's a little bit more rare, but it does happen. In those circumstances, I would say hopefully the counselor, the staff member has been able to communicate with their with that student either by email. So a lot of times in school districts, we have things like Class Dojo or Remind or different kinds of apps to speak to our students just to make contact, and then you can exchange that. But I think first of all, when we're calling, we're actually just calling the family to check in. And if the student is there, we can just say, we're checking in on all students and get that information. I hope that answers your question. The long-term counseling piece is a little bit different, but the check-in is empathetic and caring for all of our students and their families.
Thank you both. Just a follow-up question, and one of our attendees said the teachers are getting consent. Does that consent carry over or to the counselors, or should there be a separate consent? And obviously you aren't speaking for all of you know, the BBS and all of PPS staff, but how would that situation play out?
I'm not sure. It says the teachers have been getting informed consent for counseling.
It looks that way, yes.
It could be, and I'll let Tom approach that too. It could be, you know, I was making contact with students, and I was calling the number I know for them, and they didn't pick up because I usually don't talk to them on the phone. I'm seeing them in person. So they didn't recognize my phone and didn't pick up, and I have to leave a message. We're trying to make sure, using all ways that we communicate, to reach out to families. And it could be because distal learning or remote learning has started, and teachers may have already made communications with that maybe the informed consent went out that way, because just like you would put notes in a student's backpack in a sealed envelope, hopefully, for something like that. But it could be that mode is working. Tom, did you want to answer that question?
Well, I do, and that's kind of a difficult question to answer because I don't know what the teachers are getting consent for. But let's say that, you know, that maybe it's now the teacher's job to send paperwork or a digital consent, they would give that to the, send that back to the counselor. But if the teacher is getting consent for, I don't know for what, but I don't know why the teacher would be getting consent for counseling if it wasn't, I mean, if it was verbal, it wouldn't carry over, because you would really need to have that for counseling in writing, some sort of written consent.
Thank you both. Appreciate that guidance. I think, as you had mentioned in the presentation, Tom, we're all building the airplane as it's taking off at the time. So thank you. So we are right at 3 o'clock. And just want to again, thank you, Dr. Coates, Tom, the rest of our panel, the Office of the Surgeon General, California Department of Education, and Mr. Kai Jackson, Deputy Superintendent. All that were involved today, I invite you to leave feedback for us and let us know how we can further support you in your role in supporting students at wellnesstogether.org feedback. Keep an eye out on that bit.ly folder, bit.ly, supporting you, supporting students. On behalf of the Wellness Together School Mental Health team, the California Department of Education, and all involved, thank you, and we wish you all the best in the incredible work that you are doing. Until next week, Thursday, 1 p.m. Pacific. Thank you.